Artificial intelligence is already changing healthcare, helping providers work smarter behind the scenes. But how much should you trust it with your health? On this Wellness Wednesday, Rachael Rivero from Kansas Care Connect joins us with what every patient should know. Rachael, thank you so much for being here.
You're welcome. Happy to be here.
Of course. So AI, it's everywhere nowadays and even at the tip of our fingertips. So we, are asking questions about our health all the time, but sometimes we don't know what to ask. And I'm hearing that doctors are now using it too.
Yeah, AI really is everywhere, and we probably interact with it more than we realize at this point in time.
Yeah.
With like AI receptionists, when you call an office and things, it sounds like people. It's kind of crazy.
Yeah.
So I think offices are using it in that sense and helping with scheduling and just with the demands of calls. But I think where we use it more is resources for like documentation, really helping with administrative and efficiency needs, which is very helpful. I think that's something that we've needed as a healthcare provider myself. The documentation demands on the healthcare side are insane. And so I know a lot of patients will say they're just on the computer the whole time because I mean, you have to document everything and the demands of what insurance companies and everything wants. It's a lot. So using those tools to help streamline that. There are devices where, a lot of people probably have noticed a physician has a phone that's like listening and during your interaction with the provider, and that's helping them take notes so that they can get back to that interaction and not having to be typing and staring at a computer. And then it helps them just streamline that so they're not up all night doing documentation and keeping up those pieces so they can really focus on you as a person again. So I think that's great. It can help with decision making and prioritizing and running the company as a business, but it should never ever replace the person, right?
No,
whether as a patient or the provider. So tools are great for education, they're great for the documentation help, but where we really need to be careful is it doesn't replace that conversation with your healthcare provider. It can help you bring questions to your healthcare provider. It can help you know what to ask, but it should never replace that interaction with the person.
Yeah, it can be such a resourceful tool if we know how to use it. And what are some of the risks that people should just pay attention to? I know that sometimes we can get carried away and ask those questions of like, am I gonna be okay if I have a headache or something like that? You know what I mean?
Well, and we always kind of joke about Dr. Google and things too, because you can Google anything and it could be really minor, but then you get answers from it's nothing to I'm dying tomorrow. So, so we always want to take it with a grain of salt because that doesn't know you. It doesn't know your whole history. And then you want to be careful with putting sensitive information in there too, because where's that information going?
Exactly.
So always want to be careful with, you don't want to just upload all of these records and things that contain sensitive information, especially with all of the safety breaches, security breaches, things like that. So you don't want to put yourself at risk in that sense. But also, again, you just don't want it to replace that. You don't want to take the information it's giving you and not have that conversation and replace your healthcare provider. You want to still go to the doctor, still see them, and not take that as this is what it is. It can be helpful, that education it gives you. You will hear stories about people who are like, oh, I diagnosed myself with the help of an AI tool. But again, it's not replacing that provider. It's bringing that information to the provider who knows you, who has that training, that background. Medicine is such a science and an art as well. And so it's not black and white. There's so many variables. So you need that person behind it.
All right, sounds good. A lot of great tips, Rachael. Thank you so much for joining us today.
Of course, anytime.
Of course. And as always, we have more information along with this interview at cake.com/guests. We'll be right back.